It is now my privilege to introduce my former boss in Seattle. When I was with the Gates Foundation, I have many mentors and bosses, so bear with me. Dr. Chris Elias is the president of the Global Development Program at the Bill and Melinda Gates Foundation, where he leads the foundation's work in innovative integrated delivery, finding creative ways to ensure that solutions and products get into the hands of people in developing countries who need them most. Dr. Elias' professional background is in health and medicine, even though he also oversees the foundation's agricultural portfolio. Prior to joining the Bill and Melinda Gates Foundation, he served as president and CEO of PATH, an international nonprofit NGO dedicated to improving the health of people around the world by advancing technologies, strengthening systems, and encouraging healthy behaviors. In the late 90s, Dr. Elias served as Population Council's country representative in Thailand, managing reproductive health programs throughout Southeast Asia. Earlier in his career, he spent 2 years in Thailand working in refugee assistance programs, first as a physician supervising a large pediatric ward in a refugee encampment, and then as medical coordinator for the American Refugee Committee at the Thailand-Cambodia border. As you can see, Chris is one of the most respected leaders in public health that I have known. He also came from the reproductive health and family planning community. This community. Chris, welcome back, though we know you never left.
Thank you, Ying, for that kind introduction. You have many bosses, but I think this week we all work for you. Prime Minister Haile Mariam, Dr. Kasete, Dr. Delima Zuma, Dr. Oshotemayan, President Daniels, Ambassador Haslek, Dr. Bai, ministers, distinguished colleagues, and friends. It's an honor to be here with all of you today. I'd like to thank the Ethiopian Ministry of Health and the Bill and Melinda Gates Institute for Population and Reproductive Health at Johns Hopkins University for convening us here this week for this important conference. It's great to be back in Ethiopia. Earlier this year, I had an opportunity to see firsthand what you saw on the video and to see how Ethiopia's innovative health extension program is working. The health post I visited was well stocked with contraceptives. It had an active family planning program, and in the previous 8 months prior to my visit, all but one of the 36 newborns in that area had been delivered at the health post or a nearby hospital. What I saw that day, and what you saw a glimpse of on the video, explains why Ethiopia has reached Millennium Development Goal number 4 early. Despite a sizable population and a shortage of doctors and other health professionals, Ethiopia's frontline health extension workers have helped to reduce the country's under 5 mortality rate by 2/3, well ahead of the 2015 target. With strong leadership and a commitment to family planning, Ethiopia has nearly doubled the prevalence of modern contraceptives in the last several years. And the government has been successful in ensuring that women have access to voluntary family planning services and a broad range of contraceptive methods close to where they live. We have a lot to learn from Ethiopia in both child survival and family planning. One lesson, of course, is the importance of family planning and access to contraception to achieving a broader maternal, newborn, and child health status and goals. Another lesson is the importance of sustained political commitment. Just over a year ago in London at the Family Planning Summit, the world came together in support of an ambitious goal, expanding access to family planning information, contraceptive commodities, and services to millions of women and girls in the world's poorest countries. 23 countries made commitments in London, and we are already seeing great progress in advancing these commitments. Over a quarter of the countries who made pledges in London have now launched costed national plans, and we expect additional countries to make new commitments in the near future. 10 countries have held their own national family conferences to begin to plan for meeting those goals. And political leaders are stepping up and taking ownership to advance and improve family planning programs and services. This is exactly what we need: sustained political commitment, much like we've seen here in Ethiopia. Family Planning 2020 is another important way that we're carrying forward the momentum of the London Summit. One essential aspect of FP 2020 is measuring the impact to make sure that we're on track to achieve our ambitious goals. This is a key area of investment for the Bill and Melinda Gates Foundation. Better measurement tools to capture data in real time, track progress, and help identify gaps in reaching women with contraceptives that meet their needs. Tracking progress will ensure that access and usage is voluntary, and it will help countries to improve their family planning services. Through a recent grant to the Gates Institute at the Johns Hopkins University, we'll pilot this improved data collection system in 10 countries, 2 in Asia and 8 here in Africa, including Ethiopia. And yesterday I had an opportunity to visit at the Gandhi Maternity Hospital with our colleagues from Johns Hopkins to see this new data collection in process and to see the benefits of more timely, regular, accurate information that allows us to track progress to our goals on a regular basis. Surveys will be done at least once a year, and the information will be shared within countries to help them continuously manage performance and to ensure information and services are of the highest quality. This really is a unique moment in time. Governments, donors, researchers, advocates, civil society, and the private sector have come together to put the needs of women back in the center of the global agenda. As a partner with all of you here, the Gates Foundation is in this for the long term. Family planning is one of our top priorities. We doubled our commitment at the London Summit, and we've added new leadership with Elizabeth Lulay joining us earlier this year as our Director of Family Planning. Tomorrow, Melinda Gates will share with you her thoughts on the progress that we've made to date and the challenges ahead. We all look forward to working with you in the months and years ahead to ensure that all women and girls have the opportunity to realize their full potential. Thank you.